fake news, but the misinformation in Mauritius about COVID and what was going on. I think one of the
Vince, sorry, I suddenly found out how to record. So
okay.
I just want to say, welcome everyone. This is 20th of June, 2020. We're having a GFCH technical difficulties. We decided to go on Google Meet, and we lost a couple of people on the way. We are going to talk about the COVID Task Force, how we're going to be pivoting back to our main mission, and then when we have time, some leadership issues that will be arising. I want to remind the viewers who would be looking at this video recording that the GFCH is going strong. We have grown in the last month, as Vince and Shivani are going to tell you. We're still committed to the 5/20/35 vision at the core of it, with the community health officer, 1,000 inhabitants, followed in 3 pillars. You guys can look at the links that we have for the background, and we're happy to communicate with you. But without further ado, sorry Vince and Shivani for the intermission, but they are now going to be presenting our activities during the COVID Task Force when it started. So Vince was the head of the task force, and Shivani was the chief project officer of the task force. On to you guys.
Sure. So as I was saying, we started discussing ideas of how to inform the public around March with, I guess, what was a skeleton team at the time. And we, the aim was to produce engaging content that would also be very educative for Mauritius and anyone else that was interested in getting more factual information about COVID and how to cope with COVID. Over time, we accumulated a lot of really engaged members, and I don't exactly have the numbers with me right now, but we did have a lot of volunteers, probably around 15 to 20 people working on several projects at any one time. And we created some really, really good infographics, as well as general videos explaining different aspects of COVID and treatment options and ways to manage that in Mauritius. One of the 2 interesting projects that got a lot of attention were the remake of famous Mauritius song, 2 famous Mauritius songs, and so I think that was well received. And the infographics about symptoms was probably one of the highest rating. I think Shivani will probably speak about this later on.
Yeah.
We tried to integrate associate members and build on what with the momentum, I guess, to create this sense of community and this sense of engagement within the GFCH, which I think is going to be good for us going forward when we pivot and start showcasing what we were originally here for. I think that's mostly it from where we've reached so far. Obviously, COVID's died down a bit in Mauritius, and I think it's probably time to go back to our original projects and start focusing on our diabetes programs. We've learned a lot from what we created and the processes we put in place throughout that adventure, which will help smooth things as we go forward. And I guess, seeing, as Shiv calls it, mass art appeal, impacting people and engaging people was quite fascinating, and I'm hopeful that will be the case when we go forward with the diabetes project. So I'll pass on to Shivani.
Okay, so, all right, yeah, you covered just the general basis. So just to let you know, guys, but here we're mostly COVID free, and everybody's pretty much back to normal. Just everyone's wearing masks, which is weird, but everyone's getting used to it. So we've been the GFCH task force. We've been following that for every step of the way, and I think this is the perfect timing to sort of like pivot to real GFCF mission. But I just wanted to show you the Trello board that we've been working on. Can everyone see?
Yes, we can see.
Okay, so just to show you, is about like as Vin said, we've got about 20 volunteers, and it's been a tremendous amount of work from everyone. So we've done all, this is what's been published on our social media, and we've got like a real project management platform going on, which can be used as a stepping stone to whatever we're going to do afterwards. But this is a credit to Nilesh Desoy, who's also like, you know, posting on social media for us. So he was the brains behind this, and we all sort of jump on the bandwagon and try to manage every project that's been going on. So firstly, in terms of like, you know, success, we can say that, you know, we've managed to get reviews, approval from everyone. And we've got about 10 posters that's been posted on Facebook, and also about 6 videos, including the 2 songs, which were rewritten and, you know, they were reperformed, which is no small feat, right? So that just to give you a little brief overview of how our board and our project management look like for the past 2 months. And now I want to show you, if I can, because I can see all the analytics, but I'm not going to sort of bore you with all the details. But it's been gaining a lot of momentum, so that now we have like about 1,000 people who like this. So during this 2 months, we have exactly 1,125 followers. So that's a lot, guys. So going forward, I think we should keep on this momentum and, you know, start informing people and transitioning to the more GFCH mission on diabetes via the same campaign, which is posters, videos, and using the talent that we've amassed during the past 2 months, where we have like about 5 graphic designers, if I'm not mistaken, and 2 of them make really, really good videos. We've got some like part-time volunteers as well. So on that basis, I think it was a real team effort to get everything out from the Trello onto the Facebook page. So this is what we've been working on, and just getting people, engaging them. And if I can show you the analytics. So right now we're still like trying, you know, keeping the momentum, just putting out quizzes with questions about COVID, and people are responding to them. So those are all the quizzes. And what we can see is that, you know, we've sort of like, we've been, at the beginning of the COVID task force, when we started putting out material, and firstly, it was the identifier symptom. That was our bestseller, if I could put it that way. But that was because, you know, it was sort of, the timing was really good, because that people were still trying to find out, you know, what is COVID, what are the symptoms like. And we, I think, have been really helpful in terms of our Facebook, just to, you know, put out what are the symptoms in a really sort of graphic way. And that would be our video, one of the Anita video, which was produced by one of the graphic designers on board, which with the help of Vince and Shiv. This is another poster, and that would be sort of like the middle part of the campaign, which was like May time. And you see the quality of the poster, it's like really professional. So I think we still have those graphic designers on board. So going forward, just to keep in mind that, you know, we can transition, but in a similar way, but different content. The videos, and then, sorry, it's just taking a bit of time to load. But if I could just show you briefly the insight. So this is what I want to show you guys. So as you can see, I think it's a bit down, because you see all these were posters and videos that we published on social media. And that was the first one, the identifier and symptom. that one had 160,000 reach, which is a lot. So we started like losing a bit of reach. But I think that won't be the onus wasn't on us. It was mostly because the timing was like people were already getting a bit bored and social fatigue set in with regards to COVID. But in terms of we've taken this aspect of being like, you know, doing really good quality material and not just publishing every day. So we've posted like 2, maybe 3 a week at the beginning during the first month. And then we sort of like slowed down because, you know, there was not interest in just people clicking and just, you know, just making a poster, and then people were not really engaging. But I think we need to use those 1,000 likes and just build on that engagement and get more people to follow. And also now we can analyze our demographics, something which I haven't seen on the analytics yet, just to see, you know, if we're targeting the right people as well. So we've already set a base, volunteers, we've got a project management platform. We kind of know how each of us work, and bearing in mind these volunteers, they might be here, they might not, but we sort of have like a part-time commitment from, at least from the people I've dealt with during the past 2 or 3 months. So I think we should just use all that we've built, and instead of just starting from scratch again, we can use the website that is GFCF, something which we are working on at the moment, is getting the information that is on the actual GFCH website, getting into layman terms and putting that in posters, so that now we can tell people, you know, you've been following us during the past 2 months on everything we've been doing. Now, this is what we stand for, and this is what our mission is, and also try to include, you know, the artistic side as well. And we also have an artistic director, which is part of the team. We also have 2 translators, who translate for us in Creole, and the rest of the volunteers are a bit ad hoc, you know, accountants like me. And except the video and the graphic designers, we've got a really diverse portfolio of volunteers, ranging from interns to people with a lot more experience, but from all spheres of professional life. So I think that was a tremendous success, and we should just keep going. I think that would be my mini conclusion at the moment.
Thank you very much, Shivani. Anyone have any questions, clarification? Because afterwards I wanted to make some general comments.
Yeah, so yeah, good thing. Shivani, do we know where these views or hits come from in terms of high-level country, kind of?
No, we don't. So that's why I think we need to get, like, I don't know if our actual Facebook account, we can go up to that level of details, but I think that would be good to going forward.
So they have it.
Analysis.
So Facebook have these details. They have the IP address of the people that connect there. But what we need to know is just the country. We don't need to know where it's coming from, which city, but at least the country will get us to know how's the distribution of views or interest, and over time how this view per country evolve or not. So it helps us to see if the focus is coming from, the touch point is good or low, high or low, is still coming from one country, or it's getting solidified, or it's getting eroded. That could be one thing. Of course, I think Nilesh might know how to get that insights later on from Facebook.
Et tous les posts étaient en français, anglais et créole.
Now my other questions, was the messaging, I know the songs were in Creole, were the messaging in Creole only, or were they in French and English also?
They were mostly in Creole, because we got like 2 translators on board. So whatever, you know, for example, if Vince got a poster from the Australian government, you know, we just used that and retranslated it and, you know, recreated it in Creole, so that we know we were targeting the right audience.
Okay. Then yeah, of course, multiplying languages can be a bit little complexity to add. Of course, we'll need to see if we do it in French and English also, just on the view that in Mauritius we have other people that some of them trying Creole might be fun, but I don't know. Adding languages can be something to enlarge the coverage we have. But I think from the point of time we know where these hits are coming, maybe we can look at that on the second step. But it's interesting thing. And yes, I think you mentioned it, the reaching of the people, and as you say, engagement is the sensible part of it, meaning that once you get their curiosity, you get their interest, how we maintain that, the retention rate is something we'll need to work on.
Yeah, correct.
And that's the thing we're going to need to see. And obviously, it's part of this analysis to see where is this coming, high-level country. Maybe the interest in country A, Mauritius, the first focus is on some aspect, and maybe there are other people from other countries looking at it. And there is another aspect that contributes to that. So as usual, I think that's a very good evolution. It's a normal evolution. Interests get high at the beginning, especially when we touch on very sensible matter, meaning how do we identify COVID symptoms, which everybody was looking at. And then afterwards, the interest gets a bit lower unless they see something disturbing, perturbateur, as we say in French, right? Disturbing or polemic, something like that.
Like a real disruptor, right?
Yeah. So if you meet people that knows how to create audience on the web, the one thing common is the following. Publish 1 or 2 disturbing comments per week, and you get 100,000 followers after 1 month. So we don't need to create disturbing, but we need to create disrupting messaging, I think. And the disrupting messages create the envy to join us, but afterwards to retain them, we need to follow on the same thing, like once a month, maybe a disrupting messaging that helps recreate the interest and retain them, etc., etc. Maybe that's a high-level idea we need to work on, you know. So from the COVID sub website to the GFCH topics that we can, you know, transition to. The other comment, I have people now a bit more finding the Facebook page you guys have maintained, contributed, feeded. They've come to that and seen that it is a sub of the GFCH, which very interesting. And then now they are curious about GFCH and they are clicking on the micro website and going back to the GFCH a bit. But we need to check all the links.
The links is diabète. Peut-être que en fait le lien entre Covid finalement et GFCH, c'est le diabète. Donc là on voit que effectivement la vue, enfin ce qui a été vu le plus, c'est identifier les symptômes. Et on pourrait faire un truc aussi sur le diabète, enfin sur le diabète et continuer sur cette partie-là pour ensuite venir vers GFCH. Peut-être que c'est une transition en fait.
It's one of the way. Yeah, it's one of the. We'll need to think about it.
Yeah. So these are excellent comments, both of you guys. You know, Bill, anything to add on anything to react on?
My only reaction is it's incredibly impressive, and I hope you guys have taken a little bit of time to pat yourself on the back. The amount of work that went into this from volunteers and the quality of it is very impressive.
Yeah, so thank you, and that's what I wanted to focus on in what we have accomplished. And I think both Vince and Shivani, who were really the sort of the fire behind this project, are perhaps too modest to say it, but it's my job and I think my duty to say it. They just blew this whole thing out of the park, as they would say here in the United States. And let me give you some stats for you to put in perspective. When we started in March, our Facebook page was languishing. So why Facebook? Folks need to understand that most of social media, the overwhelming social media in Mauritius is through Facebook. And so when we started in early March, and you guys can go back to the meeting we had, because we were in the leadership, we were just appalled at the level of fake news that was ongoing in Mauritius, and we thought that would be disastrous for the island. we were not seeking anything but to respond to the fire that was there and present data and present information that was truthful. Our Facebook at that time in early March, our Facebook had about 50 followers. Valeur du jour, today we have 1,125 followers and counting. And so that increase from 50 to 1,125 is solely due to the people who did not talk, but just did the work. People like Shivani and Vince and Bahram and many others who just took the most precious thing they have, their time, and did the work. They put their mouth into action and their hands into action and created those items and material that is going to be one for the history book. So now we are, I think we need to take, as Surya is saying, we need to take what we have is to pivot it back into our core mission. And our core mission, if I can attempt to share my screen. Let's see if we... So can you guys see the screen?
Yep, coming.
Yep. So this is our core mission, right? Our core mission. We're a health policy organization. We have been the idea we have been peddling for the last 11 years is that we want to use Mauritius as a model to promote the 5-factor model, where we have invented this new health officer that is going to be enacting 3 pillars of clinical excellence, community engagement, and research and training. I would highly recommend those who are watching right now to go to our website, the gfchhealth.org, find the details and ask us for other materials. But this is the crux of what we want to do, and to transform healthcare in Mauritius as a model for the world. And I think Caroline insightfully said to our next step is going to be to use the analytics that we have generated, data that we have generated over the last 3 months, in what works, what engages, and for our own group, use that to promote our core business. And our core business is to decrease chronic non-communicable diseases in Mauritius as a model of the world. And what are the specific, what are the specific types of media that's going to work? And I would be remiss and greatly at fault if I did mention the amazing work that Nilesh and his team has done over the last 3 months in the back end to promote the Facebook and the analytics. Sarah Kent in Australia and others. We've spent hours looking at the details of, as you're asking, where these hits are coming from and what is the age group, which people respond, people have stickiness, as they say. So we have all those data, and now we need to go back to our business of decreasing diabetes. We will certainly continue with the quiz process for COVID, again, transition to chronic non-communicable disease in time to come. But I think we're in the right track. And so that I want to formally present a great congratulations to the team for having done an amazing work over the last 3 months, and the movement, the leadership. We're all very thankful for the hard work and this dedication with which you took to what needed to be done and do it so brilliantly for our movement and for the people. I think when you see that what we have produced has reached over 250,000 people, that is something. If you think that a fifth of the population of Mauritius or more have been exposed to what we have presented, that is something that we need to be very happy about. So, you know, with that, you know, I wanted to pivot back now in the time that we have to the projects that we have, and where do we go from here.
Shiv, can we quickly also acknowledge your guidance and your poking of getting us to do things as well in this whole thing? It wasn't just us.
Yeah, but you know, I sort of poked and you guys took and ran with it. So you know, I don't want to diminish that. I think ought to be on the team. So look, guys, it has been 3 years. I'm now going to talk about what needs to be done for the next step. And this is just a proposal. This recording will be watched by the leadership, the ALT, and the members, and we can continue the conversation. I still think that the main thing that we need to have is the letter of support from the Ministry of Health, because that triggers everything else in the setup that we've done, in what we want to do. And the playbook is very simple. Once we get the letter of support from the Ministry of Health, that will allow us to operate in the village of L'Escalier, to run the impact study, to demonstrate scientifically that the 5-20-35 model is workable, and that it brings benefit in terms of standardizing healthcare in a community, in terms of organizing the community towards healthy choices and healthy lifestyle, in terms of empowering the community to become stewards of their own health and the health of their fellow family members and their fellow community members. And the fourth sort of aspect of what the CIELAD study is going to do would be to present the health economics outcomes of this model, in terms of there's a whole group ready to do the analysis of if we prevent this many people from becoming diabetic, from pre-diabetic, how much does it save the government? How much does it save the system, the healthcare system, by using community health officers rather than inefficient, no health or inefficient systems of health? So those are the 4 outcome measures. It's going to be run over 18 months, but I have always maintained that we need a political solution. And for 3 years, we have been seeking to get the letter of support. I have to say, over the last 11 years, we have been through 5 different ministers of health. We all know where the resistance points are. We have talked about it extensively, but we are going to continue. We're going to push our advocacy to get the letter of support, because the letter of support then will allow us to get grants. I just had a meeting with the University of Mauritius. They are ready to go and deploy their human resources to run the study as soon as we get the letter of support, because or else, you know, their hands are tied. On the other hand, you know, I want to talk about the incredible time that we're living in the summer of 2020 in the United States and around the world, following the worldwide broadcast of that painful 8 minutes 46 seconds when Mr. George Floyd was choked to death by a police officer. It's going to be for the history book. You know, I think that we have reached at an inflection point where not only people in the United States, but people around the world are demanding new levels of social justice for those who are disenfranchised and those who are unempowered, right? So I'm saying all of this because how does it fit into our core mission of decreasing diabetes in Mauritius as a model for the world? I think it fits right dead center. I think that health for all is a matter of social justice. And so I think we need to ride the wave, as it were, and take this incredible opportunity that circumstances is providing to turn the pain of seeing a man being choked to death into something good, in something that enthusiasm to to show rather than tell we're going to make changes by improving the health of communities that are disenfranchised or communities that don't have access to proper good health care. In that regard, then, we want you guys know in our mission statement we are nonpartisan and we are non-sectarian. With that aspect, we will try to. I'm rewriting or writing a white paper. I was joking with the guys before the recording of the kinds of readings I'm doing to succinctly present healthcare for all through 2035 vision as a measure of social justice, as a measure of bringing health to where health is not present. In that context, then, and it really is deeply painful for me, and I had a long discussion with Nikhil Doman last night, our vice president. If we have to go away from Mauritius to test the CIELAD study, we have to go because we have a greater duty. We have a duty to Mauritius. Most of us here are Mauritians or friends of Mauritius, but we have a greater duty to the world, so that this 2035 vision is not only something on paper, it's something that becomes living, it's something that grows, it's something that has meaningful impact in the lives of citizens. I say this because there could be possibilities because of the movement that this whole summer in the United States has engendered for social justice, to have less of a friction, less of a irrational fear of testing something new, as we have seen over the last 11 years in Mauritius. It is something I sort of struggle with Nikhil when I said, you know, my goal has always been to test the 2035 model in Mauritius and then make it for the world. If Mauritius is not ready because of political reasons and because of lobby reasons, then what can we do? We are but, you know, only this many people. We don't have the levers of power. We are just, you know, from the citizenry. And if there is no push, then we need to seriously look at deploying the 2035 model either in North America, Australia, Africa, or even in South Asia. I want to stop here because please someone convince me that we should still not look at other places than Mauritius. And for those who are here, you know, if you have any comments, maybe now would be the time to go on record.
Well, I was thinking today actually about the fact that we kind of had to do something. So the main goal is doing what we were meant to do, and if the opportunity doesn't come where we would have, where our heart would have had like it to be, then it might come in time. But if there's another opportunity to test what we built and test the process, then I think that's why we're here.
So yeah, tu veux dire quelque chose?
Yeah, I think you know my thoughts there. I think I agree with your statement and then that of Vince. We can't continue. I think it's going to be tough to continue just waiting for the letter of support from Mauritius. And as you said rightly, we need to put that into action because we do believe that this will bring good for people and the people maybe in Mauritius or elsewhere. So if that should happen, it must happen, right? So I agree to that, that we need to adapt ourselves to what is possible and seek forward if there is another country for pilot testing and so forth.
Yeah. Shivani and Bill, any comments?
Yeah, this is Bill. Couple of things that I'm thinking about. One is I'm honestly feeling a little guilty. I haven't moved much further forward with a curriculum for our CHO. And I'll get going on that again. The reason I mention that is I think if we have a curriculum and can express greater buy-in from the academic world in Mauritius, that this curriculum makes sense, that that's the foundational building block of developing the outreach that we've talked about into the communities, into the villages in Mauritius, I suspect that's only going to help convince the Ministry of Health to give us the letter of understanding. And without that building block, we are one big step short of proving our point. And anything we try to do in L'Escalier is going to employ other types of healthcare professionals. I know we're kind of relying right now on the employee health office at the Omnicane, the sugar company. But I think I need to ramp up my efforts this summer to finish up a curriculum draft so we can start talking with the faculty over in Mauritius about deploying some kind of an academic program to train the community health offices that we're talking about. I think that's a key building block for our plans in Mauritius. Now, with that as a background, I do agree with you, Shiv. At some point, you have to step back from banging your head on the wall to try and get this accomplished in Mauritius and say, well, where else in the world would we be more apt to make inroads and be successful at pushing this agenda forward? The question then becomes, is the CHO model going to be the one and only model that might be adaptable in places like, you know, Australia? Are we aiming at somewhere in the outback? In somewhere in South Africa? Are we aiming at the villages? You know, there's incredible poverty in large villages right outside of Cape Town, you know, so you don't have to go far from metropolitan areas to begin to spread this. We don't have to go way out into the hinterlands of Kenya or somewhere to get our foot on the ground in some of these other continents. But again, the model may be different in those areas, and we'd have to spend some time and rely on our country-specific representatives to guide us. Is the CHO the right model in those cultures and countries, or is there something else that we should be looking at there as our sort of focal point for launching our efforts in those countries? So we are at a transition point, but I think right now I'm sensing I got to get back to getting a curriculum plan together for the CHO in Mauritius, so that by perhaps the end of the summer, we can have a very structured conversation with the faculty there around a curriculum plan. And one, does it make sense for them, the content of any curriculum plan? And two, is it something that they can, with their faculty, since it sounds like they're receptive to, you know, helping teach this kind of a program, is it making sense that they can do that? Is it operational given the resources that they have there?
Very well said. I'll reserve my comments if Shivani has some comments.
Mm-hmm.
Yeah, I think I'm sort of on the fence on this, because on one side, I can see why we're struggling, because we've been, well, correct me if I'm wrong, but we've been fighting to get this approval for 3 years now. So in terms of...
For 11 years, but really in a concerted manner for the last 3 years.
Yeah. So in terms of, like, you know, even funding, which is really important going forward, this is a huge block. So I agree with you that we should consider other places. But that said, I think Mauritius is the epitome of diabetes. It is the example of diabetes, and that's where we should start. Because, I mean, all of us, like most of us Mauritian, we've got families who've got diabetes. And, like, for me, it's just frustrating that it's something that could be culled, that could be decreased with, you know, not a lot of measures, but just like, you know, sensitizing people and just getting them to eat better, for example. And with your model as well, this is something that we could put in practice, even in L'Escalier. You know, they could start like a really simple study and then, you know, just build on that. But that said, the letter being a blog, I think we need to find sort of a different, like maybe if I can say like a disruptor, like how do we get this letter signed? And who do we approach? And what have we done so far? And what could we do differently? Instead of just trying to just shift the focus to a different country and sort of like, lose the momentum, lose everything that we've sort of, well, not we, but mostly you guys for the past so many years have worked on.
Yeah, so thank you for both of your comments. I will now address some of the...
Can I add something, Shiv?
Yeah.
Yeah, so I mean, like, it's good comments overall. The one thing is, as everyone knows here, we have limited resources, human resources, and limited and times. And I think what we've been trying to do over time is that we've been trying to kind of split all those resources across so many different kind of pathways to try to reach the same goal, which have spread us thin in a way. Yeah. Whereas I think it's kind of time maybe that we try to pull the resources together to focus on maybe one or two things. We don't have to necessarily leave Mauritius all the way kind of like on the back burner completely, but I think maybe look at something that's realistic to achieve and pull the resources towards that so that they can work on it. And then, if I still don't get whether or not the letter of support is quintessential to this whole thing, or we can try to go from a private avenue in Mauritius. I'm not sure about that, like what the deal is there, but it's probably, like you said, I think it's time to refocus our resources to something that we can actually move forward with, because I think there's a lot of people that are really interested and really willing to keep contributing and do things and move things forward. But if we are spread thin across many goals, then that might slow us down a bit more.
Yeah, totally agree with the substance of what you guys are saying. So here's sort of my evolving view, right? Our core idea and our core task list has not changed. It's always been, we have this intellectual exercise of the 5-20-35 model. Let's put it in a small group to practice, to see how it works, and then expand on it. Question in random ways, the whole notion of Soya, can you put yourself on mute because it's talking? Yeah. So the why I think that the letter of support is central. It is the one thing that is holding back everything else. Bill just talked about deploying his human resources and time this summer to finish the work of the curriculum. When you talk off record to anyone in academia, they look at this in Mauritius, they look at this plan, they look at this model, they say there is absolutely no rational reason to say that this model will not work from what is here. But you have to understand very clearly where the purse strings lies in Mauritian academia, what is the potential for the system, not any government. I'm sort of just past the current administration or the administration that was before, or to administration before that. Remember, we have been through 5 ministers of health for every shapes and colors. They all come very excited about the plan, and then the lobbies hit. And then when the lobbies hit, that letter of support is going to, it's our entry for validation, because no international agency will fund you in Mauritius if you don't have the support from the Ministry of Health. That support of the Ministry of Health may be symbolic, may be material, may be inexistent, but that letter of support creates from World Health Organization all the way down a validation for the system to say, okay, these guys have done something that has been looked at and has been vetted by the Ministry of Health of that country. Without that, it's going to be a no-starter. The second major, before we come to Mauritius or other countries, the second major issue is whether we should try it in the private sector. I think if we monetize the 5-20-35 model, we will totally lose what we stand for. Because I can guarantee you, if you monetize the 5-20-35 model, have CHOs who are trained, and you have slick commercials on Facebook and Instagram and the national TV, buy this for X thousand of rupees in Mauritius and your community will have better health. We have all these metrics that we will make a lot of money and we will be successful. But what will happen is it will create the fundamental thing where wealthy people will be able to afford this model, and it will not go to the people who are not informed, and we will lose our vision. And so I have resisted that, but I have always said public-private partnerships are wonderful. And that is the reason why we are engaged with Omnicane through their philanthropic mean to make this happen. And so I think, and there will be many people who will walk away if we go in a private business model. We will lose the aura of what we have, that we're doing this for the greater good, not for our own profit margin.
Is there not a way where we could at least start just to prove the concept in that model and then get grant and funding?
Absolutely, and that's what our organization, our relationship with Omnicane is, because Omnicane has its own local health in Escalier that they promote, and so we can use that conduit and go away from governmental sources of funding and so on and so forth, right? So that is possible, and the fact of the matter is that the last thing I'll say before Sonia, the most important thing is the training, it's the human resources, and that capacity cannot be built outside in the private sector in Mauritius. Now, in other countries it can be, but in Mauritius, building that capacity to have a curriculum for the CHO cannot happen without the participation of the MIH, the MIE, the University of Mauritius, Open University of Mauritius, University of Technology Mauritius, and the whole cadre of governmental organization and parastatal organization in Mauritius. So those are, but that's, I'm always open to new ideas, and I think that we should think about that. Although I know that I am opposed to going totally private, but I am just one voice now in this whole movement. So yeah, something to say.
Yeah, so exactly as what the question of Vincent, do we have another alternative to still try to do what we can in Mauritius? So remember, Shivraj, we had this idea initially to, in parallel, to try to test fighting diabetes at the workplace. So let me give it in a few words. The idea is we get a company large enough where we deploy that. So I was thinking about, it's not the question of selling our IP, our model, but we found a company with big enough and enough employees where we can test drive that model. But that would need also to have not only a private company where they offer that to their employee as a benefit, but also, but also a hospital or a healthcare, private healthcare unit, institution whatsoever, that can also deliver that, and after 12, 18 months or 24 months, we have these data and results to re-inject and see if the government may be a bit more interested. So we can prove and test drive and pilot it with employees of one company. I don't know, guys, medically I'm not the expert, but idea is there.
so yeah, Caroline, that has been done. That is exactly, I think the Mauritius Research Council has to be credited for deploying the fighting diabetes at the workplace that was based on the 5-20-35 model. And Omnicane did that. They have data. They demonstrate how it can work, the prototype of the CHO. So those would be our preliminary data to ask for a larger test in 10,000 patients in Escalier with control population in Espérance Trébuchet, Valle-des-Prêtres, and Rodrigue. So yes, that kind of public-private partnership, that's been done. It's sitting there. FDW at Omnicane was highly successful. You can talk to the people who ran it. They were like, wow, we did all these things. So that has already been done. We have the data, and Omnicane is very willing to share those preliminary data as part of our grant. So we need to move to the next level, right? To see it not at a workplace, but really bigger and by the way, L'Escalier is next to Omnicane. So
you mean that Omnicane and MRC has used our model or differently?
They have used a prototype of our model. So le suivi, the whole, having a comprehensive model in a community. So you can think of the Omnicane group of companies that has 1,400 employees as a community, right? So they did that. They did the first sweep. They went through the whole cataloged who has what issues medically, and they followed. They had meetings where they talked about healthy lifestyle, and they have data to demonstrate that things improved. There was a 9-month study, but you could see trend, and that was very, very important. So that has been tried away, and so the issue becomes, we need to continue these conversations, but I think that we will be pushing for the letter of support. It is a political decision. You can't cut it 5 different ways. If there's political will, we will get the LOS and we will run with it. Or else, as Vince is saying, we need to increase and change our tactical approach to get the LOS. In the meantime, we can't spread ourselves thin. So that will be one of our major efforts. The other major effort would be to continue to build the framework to have it be tested perhaps somewhere else other than Mauritius. And for that reason, we have made some great success to have representatives now both in Bangladesh and in Pakistan, medical students. We are imminently getting medical students representatives in India. And so the way that we're going to use the Indian Ocean Rim countries to have another layer of advocacy. And if Mauritius is not going to be able to do this, maybe go to Seychelles, maybe go to Botswana, where we have representatives, maybe go to South Africa, Port Elizabeth, where we have a country director. So that to be continued, but I think the general gist is in my view, we should continue seeking the LOS, but also look at this whole social justice movement, that how do we use that as fuel to test the model at a larger scale. I think we are almost out of time. Any other comments before we wrap up? Anyone? So finally, I'll say that I'm working on a new sort of reissue of the 5-20-35 Vision White Paper. in light of social justice, and how we can accelerate our and accelerate our mission and leverage what we are having now. Okay. All right, guys. I will try to make a file out of this, and I'll post it on our website, and then we can take it from there. We will continue the conversation. Have a great weekend, guys.
Sure. Steve, you didn't want to address point 6, or is that for a different time?
Let's leave it for a different time.
Cool. All right. No
Cheers.
problems.
All weekend.
Stay. Bye-bye.
Bye.